I'm Dr. Megha Sarkar and I'm taking part in this campaign called Save Tooth campaign from Dentistry Channel.Online. So today I'm not going to talk about one particular topic as such, but let's address the most commonly asked questions by the public. So in general, people first ask me the doctor which toothpaste to use. Now, if you are someone who's very worried about caries and everything, then you should first think whether your toothpaste contains fluoride or not. Now, you're supposed to check. How are you supposed to check? Flip your toothpaste, check your composition. If it contains fluoride component, then just go for it. Please do not fall trap to any of the advertisements that are shown. You should judge it on your own. You should ask your dentist, know about it, and check it on your own and then go for it. It's that easy and simple. Now let's come to the second most question that is being asked. And most of the time it has come from the guys. No offense to anyone. They tell me that they forget to brush twice. And when they forget to brush twice, they use mouthwash instead. Now, first of all, you're not supposed to do that. You're supposed to brush twice a day. And second of all, mouthwash is not a replacement for toothbrush. Now, why? You're basically using the toothbrush to remove the debris from the tooth. When you're not removing the debris are still there. And what you're doing is you're not removing the debris, you're just using a mouthwash and going off. Maybe that's giving you a better control over the breath part. But what about the food debris that are still stuck to your teeth and that is going to cause plaque, caries, calculus, a lot of problems. Hence, I guess it gets clear that you have to use a toothbrush while brushing and your mouthwash can't ever be a replacement for toothbrush. So don't forget that. So after this, let's come to the third most question which is being asked. People in general have seen very scared about this. Now that's called scaling. They'll be like, no, I don't want to get scaling done. My tooth enamel is going to get destroyed. What? The dentist is going to remove my tooth? No, we are not going to. We are taking a very simple instrument and we are removing the food debris, removing the calculus part that is stuck to your teeth, and we are helping you in restoring your gingival health, the health of your gums basically. So, no, your tooth structure, your tooth enamel, nothing gets disrupted. It's right there. I hope this would reduce the stress, reduce the scary part of it. Now, let's come to the fourth question, which is very common these days amongst parents, and it's actually good that people are aware about it. Now, parents actually come up with their kids who are 7 to 8 years old and they come up with the complaint that doctor, he or she has a gap in her front tooth. Now, what to do about it? My answer to that is nothing. You're not supposed to do anything about it. This is something very normal, and just wait till your child gets around 9 years, 10 years, or even wait till the age of 11 to 12 years. Give it some time, that gap is going to get closed. If that gap doesn't get closed, then take your child to the nearest dentist. I'm very sure he or she will help it out. But at the age of 6 to 7 or 7 to 8, this gap is very common. Even till 9 years, this is something very common. What happens is, your deciduous teeth, the milk tooth, are getting replaced by the permanent ones. So, there's a gap. And now when the canine is coming down, it comes down like this and it comes towards the center. It closes the gap when it is coming down like this. So slowly, when your child attains the age of 9, 10, 11, this gap is going to get closed because the canine is coming and closing it down. So that's also the fourth most common question. Now let's come to the fifth question and the final question. That is, how many times should you visit a dentist? Now, I would say in every 6 months. Why in every 6 months? Because in every 6 months, then your oral health gets checked. In general, when you would look into the mirror, you would be like, no, I don't have anything. But when you go to the dentist, he or she is going to check it thoroughly for you. He or she is going to check your caries, your gingival health, your calculus, plaque, everything related to your mouth. And if there is something, he or she will do it. If there's nothing, she'll send you off, and then again you come back within 6 months. I guess this 6 months period is going to help you a lot in maintaining your oral health. Going after a year, 2 years, 3 years, no, that's not going to really help you. That's all for today. I would like to end this right here. Thank you.